Good morning. I'm Dr. Brazell. I'm here at Flagler Health Plus at Mirabella. We are going to talk to you about summer safety for kids and teens. I'm going to start, and then my partner, Dr. Kaylan Brady, will come in and talk some other things with y'all. So first, I'm going to start by talking about sunscreen. So big deal with the summer coming up, we want to make sure we don't get burned. So what do we look for with sunscreen? Well, first thing we want to look for is the SPF on the sunscreen. So our recommendation is to look for something that's 30 or higher. And then you want something that's going to protect against UVA and UVB rays. So this makes this a broad spectrum sunscreen. So UVA rays can prematurely age our skin and cause wrinkles. And that's also the rays that pass through a window glass, and then UVB rays are the ones that don't pass through the window glass but are going to cause primarily our sunburn. So we want to make sure we cover both of those. We also usually with kids want a water resistant sunscreen. So we want to protect kids in the water for about 40 to 80 minutes. So look for that on your sunscreen. The next thing you want to look at is ingredients. There's two different types. We have a mineral sunscreen and a non-mineral sunscreen. You might also hear one would be a physical. So that's our mineral sunscreen with that titanium dioxide and zinc oxide. You see these more in the baby sunscreens. These are going to sit more on your skin, and then they will block and scatter the sun rays. The non-mineral ones with chemicals in it have avobenzone and some other things I can't pronounce, but they will absorb the UV rays before they cause any damage to your skin. You also want to make sure you're not getting any fragrance in your sunscreens. These can really bother your skin. Retinol A and vitamin A can actually make sunburns worse, so make sure these are also not in your sunscreens. You want to look for ones without, it's called PABA, and that stands for para-aminobenzoic acid. So those can actually cause skin allergies, so make sure that's not also in them. And then for sensitive skin, using the zinc oxide one and the titanium dioxide ones are recommended. So there's different types. We can have creams, gels, sticks, and sprays. Sprays are actually not FDA approved, but they are tested and they are evaluated for their effectiveness. Creams are usually the best for dry skin and great for faces. Gels are great for hairy areas, so it's just like a male chest or a baby scalp. And then sticks are really good for around those eyes so the kids don't rub their eyes and get their sunscreen in their eyes. They also have certain ones for babies. So they make, again, with the sensitive skin with that zinc oxide and titanium dioxide. Usually these are for babies older than 6 months. Most sunscreens will tell you can't use under 6 months. So what do you do under 6 months? We try our best to keep them out of the sun. You want to dress your baby in lightweight clothes or a hat that will cover their arms, and then some pants or a longer sunsuit that will cover their legs. Also, if you can't avoid the sun, it's still better to use a little tiny bit of sunscreen on their exposed areas like their hands and their face and feet to make sure they don't burn. Other safety other than sunscreen, again, just like the babies, wearing clothing over. So those sun shirts that are 50 SPF that cover their arms, those are really great. And then any long pants, and then just avoiding the sun time. The peak times are 10 to 4. So those are your times you really want to avoid. So going out before then or after then would be less sun exposure. So now we're going to switch gears and talk about another summer safety thing. So we're going to talk about bug bites. All kinds of different bugs. Mosquitoes, the big ones that bug us a lot around here. There's bee and wasp stings. We're going to talk about spider bites, and then we'll wrap up with tick bites. So first thing you want to do is prevent the bug bite. One of the things you want to use is insect repellent to repel mosquitoes. We'll get a little bit into DEET and things how to repel mosquitoes. Mosquitoes will stay in like stagnant areas of water, so making sure that baby pool that we left out or a little pond or things we can stay away from. For ticks, you want to stay in the middle of a trail, avoiding woody areas and high grass. If you are in those areas, you definitely want to check your child after they come out of those areas for any ticks in their head and all around the body, and make sure they shower. For bees and wasps, pretty easy. Try not to disturb their nest. Don't swat at them. They'll sting if they feel threatened. And then spiders usually are hiding in those piles of wood or boxes that are unopened, corners behind furniture. So just proceed with caution for those. So mosquito bites, DEET. A lot of people wondering, is DEET safe? Yes, it has been tested and approved by the U.S. Environmental Protection Agency as safe for kids older than 2 months. So even as young as 2 months, you can use DEET. You want to try to find one with a concentration between 10 and 20%. The lower the concentration, the less protection there is. So if you're only going to be outside 1 or 2 hours, you can use that 10%. But if you're going to be outside all day, you might try the 30%. Generally, you don't apply it more than once a day, and you can actually apply it not only on exposed skin, but you can apply it on clothing. So socks, shoes, shirts, and everything. Just don't apply it to the face. And be careful of putting it on any cuts or irritated skin. You don't want to use a product that has sunscreen and DEET in it, only because DEET will, like we said, be applied once, but sunscreen you want to apply every 2 hours. So make sure they're separate. And then the other way to prevent mosquito bites is by oil of lemon eucalypts, also known as PMD. However, PMD is not recommended for children under 3. So just think about that when applying mosquito protection. So mosquito bites. What happens if I get a mosquito bite? First thing you want to do, wash the bite. Use soap and water. And then you can place an ice pack on it to try to help with any swelling. Calamine lotion is great to stop itching. There is something called Skeeter syndrome. So these kids that get these huge welts right after a bug bite. What do you do with those? Well, Skeeter syndrome is actually an allergic reaction to the saliva from the mosquito. So it can become this red, itchy, painful swelling area that people actually think is infected. But you're just going to treat the swelling and the itchiness. So try hydrocortisone cream, a 1% over the counter, and then alternate it with Benadryl cream. So immediately after bite, start doing your hydrocortisone and your Benadryl cream several times a day, and then use that ice as you need. The next thing are these bee stings. So bee sting will leave behind a stinger that has a venomous sac in it. So you want to quickly remove the bee stinger. You use it by taking like a card or something and kind of scrape it. So you don't want to pinch that sac and then put venom more into your skin. A wasp actually does not leave their stinger. So it can sting more than once, but you're not worried about removing a stinger. So just like a mosquito, after you get stung, wash the area with soap and water, apply a cold pack. Again, for itching, you can use hydrocortisone or calamine lotion. For any pain, Tylenol and Motrin if it's of age. And then if you are stung in the mouth, you do need to seek medical attention. So going to your urgent care ER, because if it does start swelling, it can block the airways. People can have allergic reaction to bee stings. So those people will have swelling of the lips or the tongue, face, dizziness. If any of that happens, definitely need to call 911. People always wonder, well, if I got a big local reaction to a sting, am I going to have allergic reaction afterwards? Not necessarily. About only 3 to 7% will have allergic reaction to bee stings. So just keep that in mind. Most of the reactions are just going to be on the skin. And then spider bites. Get bit by a spider, wash it with soap and water, apply a cold pack, Tylenol and Motrin, and then hydrocortisone or calamine for that itching. To prevent infection, you can try antibiotic ointment over the counter. The big spiders you want to be really worried about are the black widow and the brown recluse. So if any of those happen to bite your child, straight to the ER. A brown recluse spider is one with an oval brown shape on the back. It looks kind of like a little violin. Can be found in the South, so we are in the area. It can be painless at first, but does progress to swelling, blistering, fever, and chills. The black widow spider will have a shiny black body, and on its underside will have an orange-red hourglass shape. They actually can cause a lot of painful cramps that show up within the first few hours, so that can be your signal that it was a black widow spider and to go to the ER. And then last thing is tick bites. So if you're out in the woods, you're exploring, you're taking that hike, and trying to social distance during COVID, make sure you don't get bit by a tick. So tick needs to be removed within 24 to 48 hours, or they're less likely to transmit disease. We don't really see Lyme disease here as much, but if you've traveled up to Maryland or up further north, we can definitely see Lyme disease. That's that big, round bullseye that you see as a rash that can come after a tick. But when you find a tick, you want to use tweezers to grasp it firmly and then just pull straight up. Do not twist it. Don't jerk it. Don't use petroleum jelly or try to use a match to kill it. Doing those things can actually cause an insect to burrow deeper in the skin and hard to remove, and then it releases more saliva. So check all areas of your child after coming out of playing in the woods: the scalp, back of the neck, behind the ears, behind the knees, everything. So that's a little bit of summer safety as far as bug bites and sunscreen. Dr. Kaylan Brady is going to join us to give you some more summer safety tips.
All right. Hi, everyone. Thank you, Dr. Brazell. So I'm Dr. Kaylan Brady. I'm another pediatrician here at the Mirabella location. So I'm going to talk a little bit about water safety. So we can't talk about summer safety unless we talk about water safety, right? And also some heat safety as well. All right. So when it comes to water safety, a big thing is going to be drowning prevention. So drowning, a big thing to remember is it's actually the leading cause of injury-related death in children that are 1 to 4. So that toddler age range is a big at-risk group. Another peak is also in teenagers, so age 15 to 19. But with the toddlers, it's more home swimming pools that we worry about the most. And then in teenagers, it's more open water that you worry about. So big things we want to think about are prevention. And something to keep in mind is that about 70% of drownings actually happen when the child wasn't supposed to be in the pool or wasn't supposed to be playing around water. So keep that in mind. We really want to make sure we have barriers and different layers in place so that we can help prevent drowning. So a big number to remember is the number 4. So when it comes to pools, whether it's above ground or underground pools, you want to have 4-sided fence. So we want to make sure that it covers the entire pool all around, including where the house is. So if it's covered on 3 sides, but the house is the 4th, that's really not good enough prevention for keeping a child from not getting into the pool. All right. The other 4 is if we're having slats on the fence, you want it to be at least the maximum 4 inches wide, and the maximum is 4 inches from the ground as well. All right. Another thing you want to keep in mind is a gate to have on that fence. So the gate has to be at least 4 feet high. All right. And the latch should be self-closing so that if it opens, it's going to automatically close. All right. And that lock really should be at least 54 inches from the ground as well. The gate should also open out. So if anyone accidentally leaned on it and it wasn't closed, you can't push it in towards the pool. It should open out away from the pool. Also want to keep in mind that water is fun for kids, right? It's shiny, they can splash in it. So you want to keep toys and everything out of the pool once you're done playing. So it's less likely that they're going to be interested in the pool after the fact. All right, added layers. So that's one layer of keeping that barrier with the fence around the pool. Another layer can be alarms. So remember that drowning can be silent, right? It's not always noisy. So having pool alarms, having an alarm on the gate, and then alarms on the doors, especially the ones that are facing the pool, and the windows that are facing the pool as well. Pool covers aren't a great source, but if we're going to have them, it really should cover the entire pool. Power operated ones are the best. But those ones that are soft and actually are just solar can make the illusion that it's actually a hard surface and make it more likely for someone to go in the pool because they think they can actually walk on it. All right, what else can parents do? So when our kids are playing in the pool or around water, not necessarily if they're even playing, is to assign a water watcher. So a responsible adult that their only responsibility is to actually watch kids while they're in the pool. All right, so that means no distractions. So no cell phone, no TVs. Make sure we're not under the influence of alcohol or any drugs. All right. And remember to take breaks. So it's a job, right, to watch everyone that's in the pool. So we want to make sure that you're switching off with another responsible adult as well. All right. Another thing is touch supervision. So especially the younger kids, to be within arm's length of them when you're in the pool. Best thing is to be in the pool when they're in the pool. And when you exit the pool, have kids come with you as well. All right. Another thing to think about is it's not always just pools or spas, but any sort of water that's around the house. So buckets when we're washing the car, make sure when we're done, we empty them immediately. Tubs, as soon as we're done with the bath, empty the water immediately. Remember before bath time as well, if we're stepping away or turning away, not to do that. And coolers is something to think about too. So if it's filled with ice, it melts, and that's also water that kids can get into as well. Swimming lessons is another layer of protection. So the American Academy of Pediatrics recommends swimming lessons starting at age 1 or whenever they're developmentally ready for swim lessons. This is especially important in those kids that are 1 to 4. All right, it can decrease the drowning death rate. Okay, we want to focus on water survival. So of course, swimming, the stroke for swimming. All right, also how to get back from the surface. So if you're under the water, teaching them how to get up to the surface, being able to propel themselves at least 25 yards so they can get to an edge of a pool, things like that, and how to get out of the water as well. A huge thing is also to know CPR. So if we're assigning someone to be that water watcher, make sure that they're trained in CPR as well. A big tip to remember is that if a child's ever missing anywhere, first check a pool or spa, and next check the car, including the trunk, and we'll get to that as well. A little bit on open water safety. So boat safety, really important to wear life jackets, and these should be Coast Guard approved life jackets for both kids and adults. Right, adults can also drown too, and you want to set a good example for kids as well. Always remember that floaties, toys, these blow-up toys are really more toys. They're not a replacement for life jackets and really don't help in preventing drowning. So those are not approved. It really has to be a Coast Guard approved life jacket. In open water, a big thing to remember is never swim alone, right? Always have someone else swimming with you. Keep having your water watcher there as well, no matter what age. All right, for little kids, have that touch supervision and be with them in the water. If you're leaving the water, to have them come with you. And always teach kids about rip currents too. So with rip currents, you want to swim parallel to the shore, all right, until you're out of the rip current, and then go back up to shore after that. This is especially important for teenagers. So in that 15 to 19 age group, like I said, is an at-risk age group. So for them, the part of the brain that actually controls complex thinking and impulse control is still developing. So they can often overestimate their skills and underestimate the risk that's involved. So make sure we're talking about that with them. Substance use as well is involved with teenagers sometimes. As many as 30 to 70% of recreational water deaths can involve alcohol. So to keep that in mind, and then swimming lessons as well. So it's never too late to learn and make sure that we know how to swim too. All right, moving on to heat safety. So remember with heat, especially in where we are here in Florida, right? Heat is not just a summer specific thing. So it's hot all the time here, and we're around water a lot around here too. So we have to worry about things like dehydration, heat exhaustion, and heat stroke, and how to prevent it. So a big thing with exercise and heat. So this time of year when the temperature is really hot and the humidity is high, we have to make sure that kids are staying hydrated to prevent these injuries. So a big thing is we want to limit the amount of exercise we're doing outside, especially when it's really hot and really humid, above 90 degrees especially. Any activity that's more than 15 minutes, we want to try to limit that. When it's so hot, and make sure kids are drinking. So they should be able to drink freely and not feel thirsty when they're going into that activity or sport. If it's less than an hour, whatever activity they're doing, water is typically good. If it's going to be more than an hour of exercise or play outside, you really should add in sports drinks as well to help replenish what they've lost. And to make sure we take a break. So about every 20 minutes when you're playing or exercising, to take a break and drink. Clothing important too. So we want light colors, lightweight clothing, and ideally no more than one layer. Signs that we're worrisome, that we're having any sort of heat exhaustion or heat trouble is things like dizziness, if we're lightheaded, nauseous, headaches, rapid breathing, muscle cramps, these sort of things. We want to remove ourselves and remove the child from that environment and cool off. And if it's anything severe or we're having any changes in our mental status, anything like that, that's a medical emergency. All right, we can't talk about heat safety without talking about car heat safety as well. So remember always never to leave anyone of any age, but especially infants or children in cars. And to remember this is not just a summertime thing, so it doesn't have to be super hot outside to actually have heat stroke and heat exhaustion inside a car. Kids are more at risk because their bodies heat up faster than adults. The car can actually increase temperature close to 20 degrees in only 10 minutes and keep rising. So it heats up really, really fast. Cracking a window or opening a door really doesn't do a whole lot. So really a big thing is to get them out of the car as soon as the car is turned off. What we can do to try to help prevent ever, especially leaving a kid accidentally in a car, be especially cautious if there's any sort of change in routine. So if you're taking a different route to work that day, or the child's with you on, say, a Tuesday when they're not normally, things like that, when we have a difference in our change of routine, that's when they're most at risk. So make it a habit to always check the back seat. So if you have a purse, a wallet, a bag, anything with you, keep it in the back seat so that when you get out of the car, you go to grab that, and at least you're always checking the back seat for anybody that might be there. Set up a plan with daycares or schools that if your child's not there in the first, 10 minutes late, to have them call. And super important to keep cars locked, especially at home in your garage. You want to keep it locked and the keys away. So sometimes kids will play around cars, which we want to tell them that, in a car is not a play place, especially the trunk, because sometimes they can actually get themselves locked in, and that's how these things happen. So always lock your cars, no matter where they are, even at home, and keep keys away so that they don't know where they are and they can't get into them. All right, always teach kids that cars aren't a place to play. All right. Lastly, I just want to take a moment to talk about, with everything going on this year especially, to make sure that we're also paying attention to mental health for our kids. So a lot of anxiety, depression, lots of changes that are going on lately. So we just wanted to have everyone keep an eye out. Any changes in moods or things like that in children, make sure you're reaching out to their provider so that they can help in this time as well. All right, so now I'm going to actually ask Dr. Brazell to come back in, and we can answer any questions that anybody has as well. All right, or I can answer any questions if anybody has any. All right. If not, well, we thank everybody for joining us today. I'll get my mask on now that we're together. And we thank you. We're looking forward to doing more in the future. And if anybody has any questions, feel free to ask us, okay? All right. Thank you. Stay safe.